Hi, I'm Aysha, Global Communications Lead at World Maternal Mental Health Day in association with Postpartum Support International. It's my absolute pleasure to welcome Dr. Trudi Seneviratne to our live chat today. Dr. Trudi is a consultant perinatal psychiatrist with over 2 decades of experience supporting women's mental health during pregnancy and after birth. She's received numerous accolades for her work, including an OBE for services to perinatal psychiatry, and is currently patron of MumsAid and an advisor to the Royal Foundation Centre for Early Childhood. Dr. Trudi brings a truly holistic approach to care, combining medical, psychological and cultural understanding, and we're thrilled to have her here to share her insights. Thank you so much, Dr. Trudi, for joining us this afternoon.
An absolute pleasure.
We've got some really interesting questions from our supporters at MumsAid that we'd like to put to you. So without further ado, if you're ready, we'll kick off with question number 1. What made you decide to specialise in perinatal psychiatry?
Oh, well, that's a really lovely question. Lovely question. So look, once upon a time in medical school, I thought I might do something like surgery or obstetrics, which really grabbed me. I love delivering babies.
Yeah.
But then I came across people who developed really severe illnesses like postpartum psychosis. And then I sort of decided, actually, the most important organ we have is our brain. It's not, actually, if our brain doesn't function, we have absolutely no quality of life. So that was my sort of first road to Damascus moment, if you like.
Yeah.
I trained with the psychiatrists that trained me and inspired me to do psychiatry. And in that time, I met this chap called Chani Kumar, who was the professor of perinatal psychiatry at the Maudsley, the Bethlehem Mother and Baby Unit.
Yes.
And heard him giving a talk somewhere. And I thought, oh my goodness, this is it. This is absolutely where I belong. Because I just thought, for our mental health as humans, as people, where does it begin? Well, actually, it begins right at the start. So from the moment the egg and sperm are conceived, I say that every day from conception matters. In psychiatry, everything that happens to the fetus from day 1 onwards matters. So who do you have to look after? You have to look after the pregnant woman.
Absolutely.
Because actually, what's happening for her mental health, psychologically, physically, biologically, has a direct effect on the developing baby.
Yeah.
And then afterwards, obviously, everything that feeds a baby, the nurture, nature, everything sort of helps us to develop and be the people we are as adults. And of course, in terms of preventing mental health problems, you can only prevent right at the beginning, in the truest sense. I mean, you can't prevent everything, but actually it felt like the best place to make a difference right at the start of our lives. So that was a sort of powerful story for me. I also felt that I came across people who were suffering from severe depression, anxiety, psychosis. I happened to work in a place in East London, in Hackney, where there was a 2-bedded, it wasn't really a psychiatric mother and baby unit, but there were 2 beds, tagged onto the end of an adult ward. But the mother and baby stayed together, and I saw the most amazing recovery of these women. And so that was a beginning, actually. That was a start, and that's a very long time ago.
That was
over 30 years ago now.
And that's amazing, really, because obviously you were within that maternal sector anyway. That was always your sort of dream, to be in that kind of...
Yeah, I love delivering babies. I love looking after, that bit of looking after women, being pregnant and having babies, and the joy, the joy of, it's joyful, isn't it?
Yes, of course.
It's such joy having a baby.
Yeah.
Of course, there's sadness too, and lots when things go wrong, but it's such a joyful time.
It really is, yeah. And I suppose, although you didn't go down the maternity route, doing what you do gives you the best of both worlds as well, in a sense, because you see these mothers, I guess, and see their journeys, good or bad, but are still able to be a part of both aspects of their journey.
Absolutely, yeah. And for me, there's something about being medically trained, understanding the sort of the biology of the obstetric bit, if you like, but also the psychological piece of being a trained psychiatrist and understanding emotions, and so importantly that perinatal mental health is about the family unit, actually.
Definitely.
You know, you've got a baby in the middle of it, so it's perinatal to me means sort of the mother, the baby, the partner, and you know, the father or partner, and that family unit. So it's a specialism that wraps the entire family.
Definitely.
Yeah.
Yeah.
So that's really special.
Well, it's lovely because I didn't actually know that about you, so that was good to know about your how you worked your way up through your career. So that's brilliant.
And do you know what? I look back and think, would I have done something differently? And I just sort of think, my God, no. It was the best thing to have spent 30 odd years doing. It really has been.
And that's brilliant to hear, because it's obviously been worthwhile and so rewarding for you, despite obviously going through and seeing people through their challenges as well. But just knowing that you were able to help and support so many mothers and families is just incredible.
Yeah, it's such a privilege.
Yeah. So what do you feel is the most misunderstood thing about perinatal mental health?
Oh goodness, that's a brilliant question. Do you know, there are so many things, actually. I would say a key one, maybe I can think of a couple, but a key one is that perinatal mental health is all about postnatal depression. It's all about postnatal illnesses.
Yeah.
And I keep hearing that sort of now in 2025.
Yeah.
If I wind back 30 odd years, people only ever talked about postnatal depression.
Yeah.
You know, perinatal mental health equals postnatal depression. But even now, people, you know, focus on the postnatal period and completely forget, actually, perinatal mental health starts much, you know, right, as I said, it starts from conception onwards. In fact, it starts from preconception, which is like women planning to have babies, or, you know, people planning to have babies. And that whole journey antenatally is just as important. And actually, antenatal mental health problems for women spill over into the postnatal period, and they certainly can also affect the baby if mother's not treated properly antenatally. So I think that's still a huge myth that needs busting, you know, certainly in this country, but also right across the world, as a sort of global message that when we're talking about perinatal mental health, it's not just about the postnatal period. You have to go right back to the beginning. I guess another sort of myth or something that we haven't got right at all, and it shocks me that we haven't got it right, is maternal suicide.
Yeah.
You know, it was shocking to me back in 2020 in this country that the leading cause of death for women when they have a baby was suicide. That really shocked the world, actually. But that was in 2000.
Yeah.
And here we were, you know, here we are, 25 odd years later, and actually, you know, the rates of suicide haven't reduced dramatically for women when they have babies at all.
No.
And it remains a leading cause of death. That's really shocking. Not just here in the UK, but right across the world. Now, many parts of the world haven't even analysed their data. And, you know, the UK has. And actually, I was talking to colleagues in Sri Lanka, which is where I'm from originally. And they did a maternal autopsy, which also looked at the high rates of, you know, the rates of maternal suicide over there, and, you know, other parts of the world as well. And, you know, we need to balance, okay, suicide isn't a common event, but the truth is it's you know, there are enough maternal suicides happening that you know, that story has not changed. You know?
No.
So that has got to be, you know, something we change going forwards in the, you know, in the next period of time. You know, that can't be the same story that we've held for the last 30 odd years.
I agree. It's just, I think it's definitely the lack of education, isn't it, and understanding behind it all, which is why I think, you know, days like World Maternal Mental Health Day or World Maternal Mental Health Awareness, Maternal Mental Health Awareness Week is so important to raise those issues and to help families to understand these conditions and these scenarios better, so that they are better equipped to help their loved ones or their partners or whoever that they may be.
Absolutely. And another myth is that people saying, oh, actually, you know, my partner, you know, was well, you know, she was happy and she was planning for the baby or planning for the delivery. And we can't believe that she could have been depressed. And people don't, because women put on a front all the time, so they're hiding how they're feeling. So there's such a mismatch between what they present to the outside world and what is actually going on, which is their desperation that that something's not right. So so we still need to keep, again, busting that particular myth and sort of changing that story.
Most definitely, yeah, most definitely. How can a mother discuss her mental health concerns without the fear of losing her child? And I think this kind of brings it back to the point that you've just made about, portraying the feeling that everything is all okay, I'm fine, the baby's fine, life is good, when in reality it's not, because of fear of things like possibly having your child taken away.
I know, absolutely. So yeah, I mean, that's another area where people feel so stigmatized. So they're terrified of admitting. Well, first of all, women feel so guilty anyway, because it's meant to be a time of joy. It's meant to be a time of being happy. No one's meant to be talking about feeling anxious or depressed, or certainly not talking about not loving this beautiful baby that's just arrived, or not feeling connected to them, or we're not supposed to be complaining that our delivery was painful and that we still can't go to the toilet properly, or that our cesarean section scar is not working, or still painful, and we can't hold our baby. So there's so much guilt, shame, and like a need to be perfect in all of this, not just from society, but also internally for women too. And so admitting that something might be going wrong is really, really difficult. And then there is a layer of, my goodness, if I admit something, will people like social care or social services, depending on where you are in the world, will someone think I'm not good enough? Is someone going to come and take my baby away? And that is a real fear. That is such a genuine fear. I see hundreds of women not admitting that they're unwell because of that fear. Maybe it's fear admitting to your partner or your family, but also with statutory agencies coming along and deciding that somehow you're not fit to look after your baby, which is just terrible.
Really
and that's another myth actually that we need to bust, which is that just because someone is struggling with their mental health or psychologically struggling doesn't mean they're not a fit mother or a fit parent. That's absolutely not the case.
No. And I think, do you feel that the media maybe plays a big part in that as well, and what people may see on television or in films as well, because that can kind of be portrayed as the kind of, someone's journey is, okay, if you're having, these awful episodes and you can't cope as a mother, or you can't look after your child's going to be taken away.
Yes, you're right. I think media has an enormous role to play actually in supporting parents, women, when they have babies, and to sort of not to fearmonger. So media is very, very powerful in educating, actually.
Definitely.
And it's a vehicle for education and supporting families.
Definitely so. And what role can charities like MumsAid play in supporting new mothers with their mental health? Well,
obviously I'm a huge fan of MumsAid.
As am I.
Which is an amazing charity.
They are,
I think one of the things is that what charities like MumsAid and other charities can do is that women, it feeds on what we've just talked about, actually, this fear of, say, baby being judged, or children being removed, or deemed not being good enough. I think there is a real fear for women accessing statutory services, possibly NHS services, because actually, well, first of all, you have to perhaps be slightly more unwell to access those services, because we do have, amazing community perinatal mental health teams now in this country, and mother and baby units for the most ill. But you have to be sort of a little bit more ill, perhaps. But actually, the truth is, I think everyone is. There's no such thing as mild, moderate, severe. Everybody's struggling. But there is a fear that by entering statutory services, whether it's NHS or social care, there's a bit more scrutiny going on. So, So I think charities like MumsAid destigmatise mental health to a degree, but not in any way do they sort of reduce the acuity of it or how awful it is, but just provides in some ways, a much safer platform that people can reach out to, which is safer. There's sort of the less pathologizing, if you like, of what's going on. There's the ability to also sort of meet other people that are struggling in similar ways. There's a complexity of all the things that can be provided, but it's that sort of holistic wrapping around of a woman and their family, with sort of peer-to-peer support, maybe individual work, maybe group work, maybe sort of, the spread of diversity, young mums. MumsAid has attracts young mums, and I know that actually our statutory services struggle to bring our young mums in certain parts. So, some of our diverse mums. So again, we know that some of our statutory services don't pull those mums in quite the same way. So lots and lots of lovely strengths that charities can do. And I think the best way is when the charity sector and our NHS or statutory services actually all work together.
Combine together, right? Exactly that. Yes. It's just a much more powerful force, isn't it, to help those women in need.
Absolutely. And actually we've now started to do that. So I happen to work in South London, and sort of what in that delivery of services across South London, we're trying to combine all of it as part of the sort of leadership of how those services are pulled together. Which is really nice. And it's it's the first time really I can think of in the history of development of services where we've really tried to bring together like that.
Oh, that's really good. And it's also just amazing that these charities can provide that safe space, as you said, without judgment as well. And a place where other mothers who are experiencing, similar experiences, they're on the same sort of journey, can actually relate to one another. Because sadly, I think with some families, if a mum is going through hard times, there may not be someone within the family that she can speak to or open up to, because they feel that they're not, on the same page, or they're not experiencing, or they'll not understand. So I think these groups and these sessions that are run by charities like MumsAid are definitely very beneficial and rewarding, aren't they?
Absolutely.
To make these women feel like they're not alone.
Absolutely, and really helps with stigma, actually.
Definitely so. Yeah, absolutely, definitely so. So we've obviously spoken about the importance of family and the support that they can give, but how can people support their loved one who is struggling with maternal mental health?
Yes, I think the most important is just to be there, actually, for support, whether it's pregnancy or afterwards. Is just to be there for support and offer an environment at home which is really supportive. Actually, there's been loads of studies on this, and we did lots of studies on this years ago across the world, that we asked a whole bunch of pregnant and postnatal women what were the most important things to you, and actually what women said was support, and support from my partner and my family, where I'm able to sort of talk about my emotions in a non-judgmental way, was really, really key. Not putting too much pressure on, not having too higher expectations. There's such expectations to have like a perfect pregnancy, a perfect delivery, and then to be this breastfeeding mother that somehow can multitask and do everything. That it's not all possible. I think people are put under such tremendous pressure during pregnancy and delivery and afterwards. So family can very much help bring some of that pressure down. Support with things like feeding postnatally, so that women don't get sleep deprived. Keep asking how emotions are, and spotting if things are going wrong as well. Spotting if somebody's a bit overly anxious or starting to get depressed, or any other odd signs that might be happening. I think that's the most important thing, actually.
Yeah, definitely. And what cultural considerations do you think are important when working within a diverse background? And this is one that's quite personal to me, because I'm from a South Asian background. So I know the struggles that I had when having my children, And culturally, obviously, there is a stigma there when discussing maternal mental health issues.
Yeah, so absolutely. So culture is, it's an essential part of thinking about our mental health when we're pregnant and afterwards, isn't it?
Yeah, absolutely.
But also, also to think about the structure of cultures. Some are, quite maternalistic cultures. Some are a bit more paternalistic. Some cultures, it's not the woman that does all the talking. There's some cultures, China, there's a birthing month, for example, where women are just looked after. So it's really important to include the traditions of cultures as part of the whole pregnancy and birthing process. And that includes actually for, when we're looking after women in the UK, that actually we need to hold on to the cultural traditions that, exist in different cultures, whether it's Africa or Asia or China or Britain or Ireland or wherever it is, it's really, really important. There are rituals, there are particular diets that people can have. So that's an important part of then looking after people if their mental health is also starting to deteriorate. And I guess there the important bit is some cultures don't talk about mental health. They don't have words for things like depression.
No. Yeah, that's
They might present with depression by talking about headaches or back pains or pain on down my arms, but there's no language for talking about mental health. So it's really important to sort of tap in when that might be happening and sort of not necessarily put a Western construct on someone delivering their distress, but just to be aware and alert. And actually, I think there's a lot of education that needs to continue happening to sort of reach out to different cultures and societies to say, actually, there is this thing called depression. You might not have a word for it, actually, but it does exist. And, some women, may not feel connected or love their baby because they're depressed, and that needs to be looked at. So yeah, oh my goodness, the cultural sort of lens in pregnancy and having babies is so critical and has to be factored in. Has to be factored in.
Most definitely. And the point that you made about mothers feeling that they need to be perfect or portray that they've got the perfect life and that they're fine and that their babies are fine. I think culture does play a part in that as well, doesn't it? And growing up in certain cultures, you're just expected to sort of, whatever you may be feeling, to just sort of brush that under the carpet and just put on a smile and carry on.
Totally.
Because that is how you're brought up.
Totally.
That's what you're brought up to learn.
Yeah, totally. Just the expectation to be happy regardless.
Exactly.
Like not ignore the fact that it's been a really traumatic, difficult pregnancy, or ignore the fact that actually it's hard to breastfeed. Ignore the sleepless nights and the exhaustion. Huge expectations to be happy.
Very, but again, that's where the education needs to come into, so that people are better informed, aren't they, to be able to support their loved ones within certain cultures. What do you think is the main obstacle to mothers accessing mental health support in the perinatal period?
Oh, goodness me, there's so much. There's so much. I mean, look, don't get me wrong. I think the story around perinatal mental health has, changed massively. Like my 30 years as a perinatal psychiatrist, it's changed hugely. Like, you only have to look at the UK where you've got all these, we've got all these wonderful charities, but we've got charities coming together in organisations like the Maternal Mental Health Alliance. We have, expansions of services and governments recognising so that we have these sort of NHS services. But it feels still like a beginning, actually, in so many ways. So, barriers to accessing help and coming forward. I think stigma remains huge, absolutely huge. And that is a combination of internal stigma that a woman might have. Embarrassment, shame. I can't possibly admit this. This is meant to be a time of happiness. This is a planned, wanted baby. In fact, I'm conceiving because this is an IVF pregnancy. This is so planned and wanted. I feel so rubbish. And so I think there is that women still feel very, very guilty and embarrassed about that. And we need to create a society where we can come forward without fear, embarrassment, shame, stigma. And then there is the sort of, I guess, a societal piece as well, that, you know, others around us support the process, and you know, that even if we are single parents, you know, there are other people that might support us, that partners are supported. I think dads get terribly, terribly left out in accessing support as well. So that's another area, if you like.
Absolutely.
And I think there is also barriers around professionals, sort of, actually, whether, you know, wherever those professionals might be, whether it's you know, statutory services or charities or midwives or health visitors or obstetricians or psychiatrists, wherever they are, GP, wherever they are, that I think even though there is more knowledge, sometimes that isn't enough. It's got to be a continuous process of sort of relearning and making sure we don't jump to conclusions sometimes, you know. I mean, I, you know, work on a psychiatric mother and baby unit, and you know, one of the things we see is sometimes, you know, people make referrals for an inpatient admission, say for depression or anxiety, whatever it is, and it feels sometimes a little bit, you know, the referrer hasn't thought really about, you know, is it needed, or could this be managed in the community? So there might be an over referral process, you know, into an NHS service, but actually a different setup in the community might have been better. Plugging in with a peer group might have been better. Maybe plugging in with you know, charities might have been better. Anyway, I could go on for a long time. Lots and lots of fears. And I think for our young mums and our women from sort of minoritized backgrounds, there's massive barriers to accessing care, because, you know, just simply trust of services and services and systems, trusting, you know, will my baby get taken away from social care, trusting the type of care and treatment I might get. Is someone going to force me to have a medication? I don't want to take that particular medication. Or
it's funny.
I mean, there is just so many.
Speaking of the medication, that was actually with my first child. I felt that if I go to see my GP, would I be put on certain medications, and then what implications then do they have? So there's certainly those fears there for sure, from my own lived in experience. So again, like you say, with all of these topics that we're kind of covering, it is just about breaking that stigma, isn't it? And just making people aware, and making mums aware that it is okay. You know, you're not going to be judged for however you feel, or what you feel or fear, or but yeah, that was definitely, a lot of this is kind of resonating with me a lot, and kind of bringing up a lot of feelings that I've had through from my lived in experiences, for sure. And that was a good 15 years ago. So, you know, my eldest is 15. He was 15 last month. And to think that, okay, I have those fears now, but those fears are still prevalent,
there, still there.
Today, sadly.
No, still there.
What role do hormones play in the mental health of new and expectant mums?
So this is a really important area, actually, and I think it's a massively, massively under-researched area. So actually, years ago, I was part of a study looking at sort of giving women with manic depression bipolar disorder, that's an illness that there is a high rate of relapse, particularly just after childbirth, when people can get either manic or depressed or develop psychosis. Anyhow, that didn't quite show that adding estrogen patches was going to make a difference. So there have been lots of theories about estrogen and progesterone, but actually we now have a couple of drugs that were developed over in the States called brexanolone, which is an intravenous infusion, but a tablet called zuranolone, which is the tablet form, which is a neurosteroid, which acts, so this is very scientific, but acts on GABA receptors, which also is what drugs like benzodiazepines or Valium, diazepam work on. So this drug, which sits on that sort of neurosteroid pathway, so on that sort of, you know, progesterone pathway, it, it's been shown to be effective for postnatal depression. So it's been approved by the FDA, which is the Food and Drug Administration in America, and it's going through a process over here in the UK. So I do think that hormones are a neglected area in perinatal mental health. So one of the things I do, for example, on the ward is that when women have started to have their periods after childbirth and they've had a couple of cycles of their periods and their illness is not getting better, and that might be severe depression, it might be severe anxiety, it might even be a relapse of a bipolar illness or a postpartum psychosis that is simply not responding to the conventional psychiatric drugs. And we look at hormone profiles to see what's happening with the hormone profiles, and actually sometimes you see anomalies going on actually. And an example might be that even with checking the bloods at a certain time, you see that their progesterone level is a little bit low, and one of the things I would do then is to sort of look at topping up somebody's progesterone level, or suggesting someone go on some hormonal contraception, and it does seem to work, but we need to do so much more research into working out how hormonal top-ups or changes could influence what's happening for a woman. But I think it's under researched because it's to do with women and hormones, to be honest with you. It's too complicated. The question has been too complicated to look at. But certainly, again, my hope is that in the next 25 years, we will have so much more research onto hormonal treatments that can be added on to conventional treatments, or instead of conventional treatments, for the treatment of depression, anxiety, OCD, and even as add-ons for psychosis. Absolutely convinced, because of the biology of what happens. Because actually, in pregnancy, we gradually have a massive increase in progesterone, estrogen. What happens when the baby's born? Well, these hormones have to, suddenly crash. The reason we get the blues or postnatal blues in that first week after delivery is because of the dramatic drop in hormones. And for some people develop a sort of early depression, which I'm absolutely, the biology is there. It's probably linked to that biological change. And then we have conditions like postpartum psychosis, which again is, absolutely linked to some of that dramatic hormonal shift that happens. It's just that we haven't got we just haven't got there with some of the answers for actual biological treatments we might want to add on. I mean, the other important bit about the body is that the woman's body through pregnancy and just as you deliver is in like this very inflamed state. So all our inflammatory markers are raised. So things like our white cell count is raised. So it's it's in a sort of prime position, if you like, to catch an infection as we deliver. Same, the same. If you look at women's hormones at other stages in life, premenstrually, you have conditions like premenstrual syndrome, premenstrual dysphoric disorder. In menopause, you have reduction of estrogen, progesterone, testosterone that can mimic depression, anxiety, even psychosis sometimes. So we just haven't got there yet, actually. So it's a story in progress, and I really hope that keen researchers will look at this much more going forward.
Like we're going in the right direction.
We're definitely going in the right direction. We just need to speed up some of the research.
That's it, exactly.
And we just need to say to some of these big grant-giving bodies, "Hey, come on, can we just spend a bit of time looking at hormones and psychiatric research based on this?" Don't forget, though, that historically, research into psychiatric drugs have lagged behind sort of research into other drugs. But I think they are catching up now, actually. I think they are catching up. So fingers crossed.
Yeah, no, definitely. It's reassuring to know we're going in the right way and not going backwards. And there are options there. We, as you said, just need to research more into this and put more time and money into researching these options.
Absolutely, yeah.
What roles... So, actually, if my own mother, had postnatal depression when I was born, does that make me more likely to develop postnatal depression as
new mum myself.
Yeah, it's a lovely, lovely question.
Yeah.
Again, I don't want to frighten people
Yeah.
because you don't want to just because
Yeah.
the thing about mental health condition is that there is no guarantee at all. So no, there is no guarantee that if my mum had depression postnatally, it doesn't mean I'm going to get it at all.
Yeah.
But actually, the way mental health conditions sort of move forward from generation to generation is complicated.
Mm-hmm.
So there's sometimes the genetics, there's a sort of the genetic factors, and then there are environmental factors. So, you know, there is no true genetics that say that actually there is a gene that my mum had that I will get, which means that I will then have postnatal depression. But then I might have been in an environment where my mum was depressed for quite a long time and grew up, you know, with exposure to things that meant that impacted my own mental health. So it's a combination of genetics and environment. So yes, there is a vulnerability to me developing it too, but there is absolutely no guarantee. So I guess the condition that has the most genetic transmission that we know so far is bipolar disorder, sort of from generation to generation. But again, that's not at all, you know, that's not, you know, it's not neat in that it doesn't go from generation to generation. But certainly if my grandmother had bipolar disorder and had a postpartum episode of psychosis or depression, I would think, oh, actually, I am more vulnerable to getting an episode now. And we do have the research for that, actually. People like Ian Jones and his group and others have done really good sort of studies looking at that.
But it's, and again, as you said, it's important to highlight that it doesn't mean that you will then follow that path.
Absolutely not.
And I
Absolutely
think
not.
making sure that, you know, mothers are reassured.
Absolutely not. Yeah. Absolutely not. Yeah.
What role does medication play in treating perinatal mental health problems? Is it safe while breastfeeding, for example?
Yeah, that's a lovely question. I guess what I get asked all the time from people.
It's probably quite a common question, isn't it?
Yeah, but it's a really important question, isn't it?
Yeah.
Because ideally, no woman wants to be taking anything in pregnancy or when they're breastfeeding.
Yeah.
And in fact, alcohol and smoking are pretty nasty
as
well. But we forget that they're both drugs as well.
Yeah.
So, but the truth is, so, you know, depending on what sort of mental health or psychological issue we have, I guess as a psychiatrist, I would, in looking at that holistic picture, I would always divide treatment into biological treatments, psychological, and social or lifestyle treatments. And I always sort of talk about trees with three big branches, and like the biological branch would include things like medication in breastfeeding. It was your example, wasn't it? Yeah. But actually, we're really lucky now in that there are many medicines, many antidepressants, antipsychotics, anxiety medicines that you can take when you're breastfeeding, which are completely safe, actually, completely safe. There are some that you can't take.
Sure.
You know, an example is sodium valproate. You would not take in pregnancy because we know that causes birth deformities. Or some, you know, a drug like lithium, for example, I would never suggest breastfeeding on lithium because you get large amounts of the lithium potentially going to the baby who can't control the level of lithium. Lithium is a mood stabilizer. But by and large, there are many you can take which are perfectly safe, both in pregnancy and afterwards. And that's the point of seeing a specialist that can guide you through all of this, because you can get so much misinformation going from different clinicians to clinicians. And if you need medication, it's really important that you have medication. Remember, medication is part of the holistic picture.
Absolutely,
you have medication, maybe talking therapies, and then lots of support lifestyle factors as well. But if you need it, it's really important to take it, because, you know, if you have a severe depression, anxiety, or a psychotic illness, you need the medicine to keep you, you know, to keep you well or get you better. And it's much worse to struggle on with a terrible illness, you know, that then is potentially a risk to yourself, and you can't look after your baby, impacts on the entire family. So if you need it, then there are plenty that you can take that are safe in breastfeeding. And
it's just
yeah,
having that reassurance, isn't it? Knowing that they're completely safe.
yeah. So yeah, you can never give 100% guarantee. You're just sort of picking up on that point, because the information we have on drugs and medication is just based on how many years it's been out there.
Yeah.
But certainly, some of our antidepressants and main psychiatric drugs have been around for decades now. So we've got quite a lot of evidence that we can say it's okay. We've got registers for things like lithium, or this one's been around for 30 or 40 years, and we've got lots of studies, or loads of women have taken this particular drug, breastfeeding. There's been no harm to the child as far as we can see. And there are lots of lots of myths out there about that. Antidepressants cause autism, antidepressants cause ADHD in pregnancy, and those really, those need to be. And there are ongoing studies that look at these sorts of things, but it's really careful that you don't just sort of go, looking at the internet all by yourself and coming up with an answer.
Media plays a part again, isn't it, as well, when you see certain stories or you see maybe reports that don't have proper backing or whatever, but that's out there in the public eye, so people then sort of fall into that trap of believing everything they read or see, which is why it's really important to get, as you said, professional advice.
Absolutely. And also people have a choice. They could. It may be that you don't need medication. It might be that actually some talking therapy, or parenting support, and being allowed to go off and have some time away from your baby, and someone else looking after the baby, that helps. But actually, if you're, the type of illness that really does require medication, then it's much better to take it, which will hopefully support the journey of recovery, than struggling with being unwell and not enjoying life, or even getting so poorly that something terrible happens. Totally. Yeah, totally.
What support do you feel is missing for women navigating perinatal loss?
Yeah, well, I think that has been a big, hasn't been as well as it could have been. I think, again, we've moved further in that story in the UK. So I think now maternity services, and we have these services called maternal mental health services across England, which were an add-on to the pre-existing perinatal mental health services. And these services, for example, are located within maternity services and can pick up women who lose babies immediately, whatever the cause of that loss might be, whether it's a loss through IVF or through a stillbirth, at whatever stage that stillbirth might have happened. And it also addresses women who lose their babies to social care because they are deemed not to be able to look after their babies. So I feel like those services are in their infancy, actually. And there are a whole host of sort of, talking therapy services that might support people. By and large, I think it's a continuous journey, because I think, staff they need to continue being supported, midwives, obstetricians, psychologists, psychiatrists, whoever they are, charities. There are some lovely, lovely charities as well that look at baby loss and pregnancy loss, which are good. And I think there's that peer support element there. I think, again, that's where the importance of, those peer support charities and women being able to reach out to somebody else who's also lost their baby, whatever that is, the circumstances, it's devastating, isn't it? And then to go on to have another baby or try for another pregnancy on the back of a loss is incredibly, incredibly difficult. But some really good charities, I think. I think my favourite resources are probably charities. And I think these growing maternal mental health services are working really hard to plug a gap there.
Yeah, for sure. They absolutely are.
Yeah, again, it's something women feel so ashamed and embarrassed about and angry about. And it's a loss, isn't it? I mean, it's a grieving process, isn't it? Somebody has died, and it's sort of, it's a, you know, there's a normal grieving process, but then also things can turn into sort of delayed grief and anger towards partner, family, system, healthcare professionals, anger at the, you know, if they do go on to a new baby, there may be joy with a new pregnancy or a new guilt. There might also be the opposite, which is, oh my goodness, you know, you're still with the baby that's been lost and not being able to sort of move in and focus on the new baby. So it's a really hard, very, very tough. Yeah, lots more to do.
Yeah, definitely. What do you find most difficult about your work as a perinatal psychiatrist?
Oh, I love that. Well, the starting point is I absolutely love what I do. I love what I do. I really
and I think
love.
That shines through for sure. I can see how much you love the work that you do.
Yeah, I just feel, get tearful. But I just feel so privileged to be working in the space that I'm working in. It's such a privilege. I suppose the hardest though, because I do, you know, the hardest is dealing with loss. Yeah. Wherever that loss happens to be. Yeah. Whether it's a baby loss or a pregnancy loss or a baby loss a little bit later or the loss of a mother. And even more rarely if it was a loss of both together. So I think that is by far the hardest thing I've had to deal with. So, you know, in perinatal mental health, sadly, we do have to hold on to an awful lot of risk and near misses and, you know, women who've nearly died, an awful lot of them. And I think that's one of the challenges of professionals who work in that space is holding on to wrapping people when perhaps they want to disappear off this planet. But so there are so many. It's like there's a bit. There's this, you know, the iceberg picture where you've got the tip of the iceberg. So you've got like a million near misses underneath, which is what I guess holding on to so many of those. That is hard. I find that really, really difficult because, you know, like on an inpatient ward, for example, it feels like all of the mums sometimes. Or in the community too, it can feel like an awful lot of people. That's hard, but I think even harder is when actually somebody, you know, does pass away, and particularly if they've been under your care. And you know, I've been a psychiatrist for 30 years, so that there are women that have been under my care or were under my care in other services, or as a subsequent baby, who have sort of, you know, have passed away, and then, which is incredibly sad because you know them really intimately and really well, and you have so much hope for them, for their futures, for their children, and then sort of supporting their partners and families actually when this has happened. That's really hard. I mean, I can tell you some. I haven't got time now, but you know, the stories of, you know, people who've died and their partners have reached out immediately, you know, just because it was a safe, you know, I was the clinician looking after them once upon a time, and it was their immediate response to sort of reach out for support. And it's so that is by far the hardest.
They always become, I suppose, family as well,
don't
they? Because you are working so closely with them and you're such a huge part of their lives.
Yeah.
You build up these bonds, don't you? These very personal bonds.
Completely, yeah. And you have to, so I was like on the mother and baby unit. I would say to people, you know, whether they have family or not, I always say, look, you know, for the moment, we are your family. We are your family. You've got to treat being here like being at home, actually. And we try and make it their home for however long we're there for. And, you know, they can be there for weeks and weeks and weeks sometimes. So they do, very much so.
Thank goodness for people like you who are able to provide such amazing support
Aww.
to not only the mums but also to the families as well and the partners.
Oh, thank you. Well, fortunately, those are rare, fortunately. Like, I reflect back and I think 30 odd years, but actually it's not very many times that this happens. So it's just like keeping that balance, actually.
I think that was also then a testament to you and the work that you do and the love and the support that you do provide then as well to your patients and your mums.
With the wonderful team that I work with.
With your wonderful team, for sure. Yeah, because it's definitely an army, right, that helps make all of this happen.
Absolutely,
so,
yeah.
And with that, I have one last question for you.
Okay.
So, what's the one thing you wish you knew when you were a new mum?
Oh, goodness. Oh, no longer a new mum. My two beautiful babies are now 22 and 19.
Oh, wow. Yeah,
but
will always be your babies.
They are always
no matter how old they get.
Always my babies, absolutely, yeah. God, that's a really, really tough one. But do you know what? Something does jump to mind. And it's about breastfeeding.
Okay.
Funnily enough, for both my babies, actually, even though they're like 4 years apart. So with my first baby, when they were a baby, so even, and actually when I had my first one, I was already a consultant perinatal psychiatrist. So like, I was way down the line of being educated about obstetrics and breastfeeding and psychiatry, and I was already a specialist perinatal psychiatrist working on across perinatal services. But what so shocked me, and my older one was term. It was a challenging time, actually, because my dad had just passed away 3 weeks before he was born, and my dad was a pediatrician. But that aside, it was, so I went through a normal delivery, and I was very, very happy that I did yoga, because my yoga breathing kept me nice and calm. I did my yoga breathing, and all I needed was my gas and air for my little one to pop out, for Sam to pop out. But then, my God, breastfeeding, I could not believe how painful it was. It was honestly, it was a total shock to me how painful it was. My breast was really, really engorged. And I had this beautiful full-term baby on me, and I was obviously going to breastfeed because that was the plan, right? But but my goodness,
I think a lot of people can relate.
Honestly, I could not believe how painful it was. And I remember, and I was still on the postnatal ward, so you have this process, don't you? You have to get kicked out of maternity, can you do a 6-hour discharge from hospital after you've had your baby? And so I was staring at this 6-hour discharge thing over here, just had my baby in my arms, and it, honestly, as they latched on, it was literally like somebody was clamping my nipples with some pain device and chopping my nipples off or something. I couldn't believe how painful it was. And so that was a real shock to me. Honestly, I sat there, and my poor mum, who was Sri Lankan, who is Sinhalese, and she was behind me, and she said, darling, why can't you do this? You're a doctor. Which was not helpful. But it really sat with me that why my whole journey as a professional had no one really, and I dealt with many, many obstetricians, midwives, psychiatrists, perinatal psychiatrists, and what have you. I was working on a mother and baby unit. But it wasn't talked about how painful breastfeeding could be. And it took me weeks for the pain to calm down and, to get the breastfeeding going. I mean, I did do it, and I persevered with my cabbage leaves and, all the lotions and potions and what have you. But goodness, it was a real shock, actually. And since then, my eyes were completely changed about, I knew breastfeeding could be difficult, and I knew that, women had different amounts of milk to give. And one of my phrases now is, we're not all lactating cows as women. We're all designed differently. Some of us have buckets of milk, and some none at all. If we're stressed, actually, we don't produce any milk because it cuts off our milk supply. So I have a whole new story and, advice to give for women. And there's so much guilt around breastfeeding, isn't there?
There really is.
Really, for women.
I felt that for sure.
Loads of guilt. I mean, I can't begin to tell you how many people come on to into perinatal mental health services because they've got so depressed, anxious, or even psychotic because of a breastfeeding issue.
Yeah.
And then breastfeeding also links to my second baby,
Yeah.
my beautiful second baby, who actually decided to pop out a little bit early.
Okay.
Always been early in life,
Okay.
so carried on with that picture.
Yeah.
But he popped out early,
Yeah.
and because he popped out early, and I was in my 20s weeks sort of gestation, my breasts were not quite ready,
Right.
hadn't quite kick-started to producing milk yet. So out Jake popped, and I was only about 8 weeks pregnant.
Oh,
So it was
wow.
all a bit of a
Okay.
shock.
Yeah, yeah.
And off Jake went to special care, and he's in his little, his little unit. And one of the nurses there, sort of, as I hobbled along, and already in a bit of shock because he's come a bit early.
Yeah.
And then one of the nurses there in the special care, she didn't mean it at all, but she sort of said, "Come on, mummy, where's your breast milk? Your baby needs you." And I was like, "Hang on a minute, I haven't got anything here at the minute." It was like, and because my body everything had gone into shock because he'd arrived so early.
Yeah.
Actually, when babies do arrive premature, your breasts are just simply not ready to be producing milk. It takes time for the body to biologically realize that there's no baby in there anymore.
Yeah.
And so the milk did, but it took about 10 days or so for the sticky colostrum to start at the beginning, and then there was milk, and then but I couldn't believe the pressure these SCBU nurses put on me, sort of time after time, every time. And I totally understand that, SCBU babies need milk, breast milk, to help, with all the infections and everything. So look, one of the things I say now to women is that, every drop of milk is golden.
Yeah.
Even if it's that sticky colostrum that you give right at the start, and you only manage for a couple of days, and then, the sticky yellow colostrum turns into something a bit more milky or yellowy. If all you've managed is a day or a couple of days or a little bit, 2 weeks or a month, then think to yourself, every drop is golden, and you've done an amazing job for your baby. And don't worry about the guilt of sort of needing to stop or having to stop. And sometimes I have to, because of how ill women are that I look after, they have to stop breastfeeding temporarily because of the medication. And I sort of, try and give people as much choice as possible, but equally remind them that it's okay. You don't feel guilty. Don't anyone let you, make you feel guilty. So it's just, so those are, sorry, I've taken time to tell you those two stories, but but those were really quite sort of profound examples for me personally, from each of my babies, that which I now sort of actually have helped me to sort of think more carefully about what I say to people, but also what other people say as well. Actually, if I hear other professionals saying things that just pile on pressure unnecessarily, which is not what women need. They just need to be nurtured and loved.
Absolutely. And I think you made really two important points there, is that not any one pregnancy or breastfeeding story is the same, right?
Oh, my goodness,
I know that,
no.
it was different for each one of mine. It was not the same. And they all had different struggles, much as you had. And then also that it's okay. Whatever you're doing is good enough.
Absolutely.
No matter how small it might feel or how big it might be, I think it's just knowing that it's okay and you're doing a good job. I think having that reassurance is really important.
Absolutely.
Thank you so much, Dr.
Pleasure.
Trudi.
Pleasure.
I really appreciated you.
Thank you.
Sitting down with me today and just being so open and raw and honest, and just love getting to know you.
Thank you. It's been a pleasure. Thank you, Aysha.
No, thank you.